A very good afternoon to all of you. And I'm going to present on the topic, our novel methods of cancer cervix screening, Prudential. So first of all, greetings from Qatar. And I do not have any conflict of interest regarding this presentation. So a brief overview about the magnitude of the problem. As we all know that cervical cancer is the fourth most common cancer in women. And according to WHO estimates, in 2018, around 570,000 women were diagnosed with cervical cancer worldwide. And about 311,000 women died with the disease despite HPV vaccination and prevention approaches worldwide. The current management of cervical cancer, that means implementation of screening, anti-HPV vaccination, and treatment programs have significantly decreased the mortality rate in highly developed countries during the last decades. However, in low and medium income countries, the magnitude of problems still remains the same. If we look at this figure, which shows the demographics of CS cervix incidence worldwide, you can see the areas in orange and red still have the incidence of 100,000 to 500,000 and more yearly. This is an estimate by Center of Health Protection, which estimates the age standardized incidence rate, and this show a decline overall. However, as I've shown in the earlier figure, that the incidence is still high in the low and developing nations. There was a study done by Aruma et al. In 2019 in Norway, in which they studied the prevalence of precancerous cervical lesion in Norway. And to their surprise, they found that there was an increase in the incidence of CIN3 and AIS lesion, as you can see with the red and the green lines. So in current programs for screening and diagnosis of cervical cancer, the critical issue is an increase of efficiency and accuracy of screening and diagnostic techniques. Conventional methods like Via, Willi, Pap smear, and HPV DNA, including colposcopy, are being implemented worldwide for screening CS cervix. But usually 3 visits are needed to a medical professional and several visits in total to obtain the diagnosis and treatment. And in this, lots of patients are lost to follow-up. New methods of cancer cervix screening like KRHPV assays and immunohistochemistry using P16 and AI6 optical methods have shown promising results in detection of cancer cervix pre-malignant lesions. However, the newer methods have their own advantages and disadvantages. The implementation of newer techniques may bring an alternative to conventional methods for screening and improvement of colposcopy for guiding the biopsy and diagnosis. So I did a comparative analysis of diagnostic accuracy and cost effectiveness of conventional and novel methods of CS cervix screening. So as we know that the progression of disease is in a way that once the HPV infects the cervical cells, the progression from infection to CIN2 may happen over a few months. However, from CIN2 to invasive carcinoma may take up to years. And that is why these are the areas in case we treat them at this moment, we can prevent the disease itself very easily. So as we know that ACOG guidelines for CS cervix screenings are very clear in recommendation. However, the problem comes when it comes to the treatment. Whenever we have abnormal areas of cervix, then comes the question of how many times the patient has to come to the clinic. So in this regard, I will be looking now into each method of CS cervical screening methods that are newly being developed over the past 2 decades. So we all know about the conventional methods, but spectroscopic methods for studying CS cervical lesion are the upcoming methods of diagnosing cervical lesions. They include lots of ways of detecting the lesion, and some of them are diffuse reflectance, induced spectroscopy, fluorescent spectroscopy, autofluorescence spectroscopy, and Raman spectroscopy. Imaging studies include confocal microscopy, optical coherence tomography, Muller matrix imaging polarimetry, and photoacoustic imaging. So in my study, I've done a narrative review for a comparative analysis of diagnostic accuracy with the newer methods and compared with the conventional methods for CS cervix screening. So in this study, I have done a online search through PubMed, Scopus, Cochrane, and Embase, and I found 27,519 studies relevant to this. And after excluding the inclusion criteria, the studies were 1,344. And then I've taken full studies that were available, which were 254. And after excluding the results of interest not mentioned, I have total 52 studies that I've included in this narrative review. The conventional methods were studied in 12 studies and HC2 assays in 10, and immunocytochemistry in 12, and optical methods in 8. The studies were published between 1990 to 2020, were evaluated, and total of 52 studies, as I mentioned. So I'll be looking now at each of the newer method one by one. So starting with the immunohistochemistry methods, it has been found that overexpression of P16 with or without K167 indicates neoplastic transformation of human HPV virus infected cells and may more accurately predict underlying cervical intraepithelial neoplasia of grade 3 or worse. A recent systematic review and meta-analysis showed that P16 immunocytochemistry has higher specificity than high-risk HPV testing to detect underlying high-grade squamous intraepithelial lesions in triads for ASCUS or even for LSIL. Another meta-analysis confirmed that P16 staining and P16 versus Ki67 staining are more specific not only for CIN3 but also for CIN2 and above lesions as compared to HR-HPV DNA. Although P16 staining only is less sensitive for CIN3, but if we do a dual staining, including Ki67, the results are good and much better than high-risk HPV study. This is just an overall view that in cases where HPV positive cases are detected, and if we can do the staining with P16 or K167, the follow-up becomes very easy and the management gets easier as well. If we looked at multispectral imaging, the basic aim in this is that spectroscopy emits light from a probe into the cervix, and this allows the examiner to objectively categorize the tissues, whether it is normal or diseased. It is based on the principle that epithelial tissues that are abnormal have different optical properties than normal tissues, and these optical differences can be used to determine whether a tissue is normal or abnormal. These are non-invasive methods and they are very rapid in diagnosis. Multispectral fluorescence imaging based on quantum dots can help improve even tumor classification and predict tumor prognosis. So this is just an image to show, as you can see here in the figure down here, this is how we see an image on after application of acetic acid. However, when we put it to multispectral analysis, you can see that in different sections, it can pick up the lesions and they can show us in colors of yellow, green, dark green, and black. The yellow means low-grade lesions and light green means high-grade lesions. ASI is by dark green and black invasive. So you can see with different filters during colposcopy, the things become very easy and we can take the biopsy and treat it accordingly depending on the findings attained. Looking at the multispectral imaging, as you can see, this is a case of very evident mass that you can see which is protruding through the cervical os. However, if you would see the image by the naked examination, we might miss some areas. However, looking into the imaging through the multispectral imaging, you can see that all the areas in red and yellow are the ones which are CIN2 and CIN3, and this imaging can help us in not missing any areas that are malignant and help in the treatment in the same setting as well. And it has also been observed that if we combine the colposcopy with the dynamic spectral imaging, then this also gives a high sensitivity as compared to conventional colposcopy that has a sensitivity of only 55%. And when we combine both of them, then the sensitivity was studied as high as 88%. And you can see now that this is just the first image is a simple, this is the view of the cervix after application of acetic acid in figure 2. And you can see after applying the dynamic spectral imaging, things become so clear in the areas which are in green and red can be easily identified and treated in the same setting as per the need. Looking at the findings of colposcopy and spectral imaging, you can see that in colposcopy, you might miss some areas that might be pre-malignant. However, when you do a mapping, you can easily identify them and the biopsy can be more specific, or if you can treat it in the same setting, that can be done. Regarding the optical spectroscopic instruments, some of them may be used for scanning the suspicious sites of cervix. They are also non-invasive, but the benefit of this is that they give results similar to histopathology. I'll show you the slides later. And the sensitivity of this is up to 79%, and the specificity is reported as high as 88% for HSIL lesions. And the reported sensitivity was reported in one study of as high as more than 96% with the specificity of 16%. The only issue is that the total setup is a bit cumbersome, and that is not suitable for CIN screening for all age group, only for high risk population. So as you can see in this figure, you can see the images that are obtained by optical coherence tomography, and in which you can see that the images are quite similar and they are interpreted according to the histopathological findings. As you can see in the figure A and E, they are corresponding to the normal cervix, and in the figure B and F are the same imaging upward for the optical coherence tomography and corresponds to inflammatory cervicitis. And in C and G, you can see CIN1 lesion. However, in D and H, you can see the comparative analysis of the images obtained in cases of cervical cancers. So this is a very good modality, except for its entire setup being a bit cumbersome. However, the results are quite satisfactory with high sensitivity and specificity. Looking at this another modality, which is called photo-optic method of imaging. In this, you can see the images in this C group. These are the kind of images, and these are the histological images of the similar tissue. As you can see in CIN2, what it will do when we put it to the spectral imaging of these images, it can easily give us an idea of the CIN2 and CIN3 lesions, and the area marked in yellow and red are those which are pre-malignant, and the biopsies can be taken and treatment can be done at the same setting. Another method of spectrometry is molar matrix imaging, and in this, the detection and quantification of modifications based on the collagen fibers in the uterine cervix due to development of the precancerous cervical lesions. This new imaging tool performs very fast acquisition of molar polarimetric images, and it eliminates any blurring effects due to patient movements. And this is the benefit as compared to other imaging methods. And it can be easily used by a practitioner with little change to their existing practice. However, less studies are done in this regard, and future studies are needed to define their specificity and sensitivity in this regard. These are the images obtained by this method. So if we look at the overall methods and compare it with the conventional method, as we can see, conventional pap smear has a sensitivity of around 51% and specificity 66%. If we do it liquid based, it increases to 55.3 and specificity 77.7. Wires have 61 to 91% and Willi 70 to 92%, colposcopy 62 to 90%, care HPV assays 82.4 to 93.6%. Hybrid capture LISA assays 85 to 95.3%. And if we involve P16, K167 immunocytochemistry, the sensitivity increases to 94.2% and on an average. And optical methods have been done with the sensitivity of 91% as an average and 83 to 100% sensitivity as studied in other studies, and specificity corresponding to 80 to 100%. That is better than any of the other methods. Looking at the cost, there was a study conducted in 2016 looking at the cost issues with all this. So as we can see that the cheapest among is again colposcopy. However, even conventional colposcopy could cost higher. But in regards to this, the only comparative for now is the fluorescent and reflectance spectroscopy that are nearly the same, but still a bit higher. And the costliest one is the optical coherence tomography because of the need of a higher setup. However, once setup is done, one initial investment can cause things to be better in other patients later. So of the three techniques, fluorescence and reflectance spectroscopy is the cheapest, but not cheaper than conventional colposcopic devices. And because it is important to first show additional value of an alternative technique, we did not perform a cost-effective analysis of these devices, which were not available in literature. So overall results in comparison to conventional methods, CARE HPV assays, hybrid capture-2 test have higher sensitivity and specificity. They provide logistical and economic advantages, but lack sensitivity as compared to HPV DNA. Detection of TERC predicted progression to CIN 1, 2 to 3 after a follow-up 2 months to 3 years with 100% sensitivity and 70% specificity. Cost and need for technical skills are limitations of this. Sensitivity and specificity of P16 dual staining for CIN2 was 74.9 to 90.9 and 72.1 to 95%. This method is useful if the unnecessary and it can reduce the unnecessary follow-up of HPV positive patients and is cost effective for HSIL. Optical methods of screening are emerging as non-invasive tests with high sensitivity but low specificity for HSIL lesions. They may be considered as first-line screening and triage for high-risk cases where there is high prevalence of the cancer cervix. So this is all about the comparison. They are found to be most sensitive, specific, cost-effective are the old methods. They have high sensitivity. We can see and treat on the same setting, and this can reduce the follow-up visits. So overall, they have high sensitivity, but for future studies are needed, and probably they can reduce the burden of economy on the government if they are employed at different setups. So conclusion, the novel methods are cost effective in women with HSIL and those who are HPV positive for better sensitivity as compared to the conventional methods. These were few of my references. And at the end, I just want to say there's nothing to prove, but all the efforts to improve. Thank you very much for your patient listening.